Well, first of all, I want to introduce myself for those that don't know me. My name is Carol Gelbard, and I am the Director of Emotional Wellness for NDF. A little bit about my background. I served on the board for over 8 years, and I have several relatives that have GNE myopathy, so I'm very familiar with the issues, and I have definitely interacted with some of the patients over the years through my roles. And I'm very excited today to present Dr. Kubacky. Just so you guys know, we looked very, I took a lot of time to find somebody that I felt would be very attuned to the issues of our organization. And I talked to several colleagues, and Dr. Gretchen Kubacky's name came up repeatedly as being the go-to person for people with chronic illnesses and how to cope and manage them, all the psychological issues that come up with that. So I was very excited when we brought her on board to facilitate the patient groups at our symposium over the years. And when there was a need for this topic, I was like, she would be wonderful. So I was really excited to have the opportunity to get to have her present on this very personal topic. She is a health psychologist in private practice in Southern California. She's also a certified PCOS educator, frequent lecturer on women's health, and a founder of a popular website called PCOS Wellness. She's dedicated to education, advocacy, empowerment for women and girls with PCOS. She is also very experienced with the rare disease community, and she, as I said, spent several years facilitated groups at our symposiums. And I also really excited because she just published another book. It's called Moving Through Grief. And I just told her yesterday I wanted to order it because I think a lot of people that are managing a disease that has a progression are constantly grieving. So I thought it would be a nice tool for people to kind of look at to process the grief when they're dealing with the disease, where they do lose some functioning. And when that happens, it's processing that as kind of like working through some of the grief that's associated with that. So without further ado, I am going to turn it over to Dr. Kubacky, and I will tell you, I will facilitate the Q&A at the end. I would like you guys to feel free to send your questions directly to me in the chat, and then I will read the questions, and I will not disclose people's names just to keep the privacy for the people in the group, as well as if people view this call later. All right,
great.
Go ahead.
So thank you so much, everyone who is tuning in now and who's tuning in later. This is a really important topic. So just the reminder that's on the slide, turn off your cameras and mute your audio for optimal confidentiality and sound quality. Also do know that even though there's no doctor-patient relationship created here, anything that you ask me right now, or if you want to send me email later and inquire about something, is held in absolute confidentiality as if you were a client. Okay. So this is about exploring intimacy and physical connection broadly, but we're going to get really specific too. So Carol told you a lot about how I have worked with the organization over the years, and broadly I'm a health psychologist, so I help people deal with chronic illness and all of the related issues and losses with that. And what we're doing here is part of the ongoing speaker series to provide patient support, recommendations for good mental health practice, particularly in this area where Carol and I were discussing. There is next to no research on the topics we're about to be diving into. And so a lot of this has been culled from and extrapolated from what little research we do have. So know that this is definitely a work in progress, and I am here to learn from you just as much as you are here to learn from me. So if there's something that you have to offer, please do feel free to pop in with your experience. I appreciate that. Also, despite having a chronic illness issue and something that is degenerative and life impactful in very significant ways, there is still a real ability and capacity to thrive in your life. And I see many of you who are having really kind of amazing lives while working and living with this disease. So the other thing that's going on right now, of course, is the pandemic or the COVID-19 crisis. And we came up with this topical idea because part of what's happening with all of the stuff that's going on with that and all of our need to be quarantined is that we've got people who are living in close quarters, perhaps not ideal circumstances. Maybe one person is trying to work, maybe you're in a small apartment or home. I have one couple I work with where they're both doing work from home and they have a 1-bedroom apartment. Another couple that was trying to do the same thing from a studio apartment. And we've also got things like college students and other family members who maybe have been called home. So you have extra people and maybe a whole lot less privacy, not to mention all of the stress that goes along with living in the middle of a pandemic. So we're going to focus on doing what we can within the circumstances that we have and opening up some creative possibilities for intimacy and all of the other relational issues. So of course, this is a huge topic and there's a great deal of information specifically about how couples work, but this is definitely something that goes beyond just the emotional. We've got physical stuff to address as well. So I want to, with all of that being said, intimacy is for everyone. Just because you have a disability, a chronic illness, or some loss of functioning does not mean that you do not deserve or are entitled to intimacy. Everyone needs intimacy in order to thrive emotionally. In fact, we do poorly. You may have heard about failure to thrive in infants. It is something that was first discovered last century when there were many orphans due to war circumstances, and they found that the babies that were just treated as if they were objects to be maintained, they were diapered regularly, changed, fed regularly, and so on, failed to thrive. They didn't gain weight. They didn't develop well mentally. And the babies that they realized were getting held were actually thriving despite these horrific circumstances of being in the middle of a war, being parentless, and so on. We can take that and say, this is absolutely true of human beings also. We don't do well without human contact, intellectual contact, emotional contact, and physical contact. We all need touch. And it's really important. So I'm kind of crossing over in terms of the definitions here, where we're talking about sexuality, physical intimacy, also emotional intimacy. And within that, we all still have the ability to please others. And part of how we please others is by having and creating intimacy. In fact, there's a form of therapy I practice where what we say is that when I'm excited about what you're sharing with me and you're excited about what I'm sharing with you, we have created a zesty relationship. So not zesty like the Italian salad dressing, but zesty in terms of like, this is so exciting. I can't wait. I can't wait to talk to you some more, right? And that is something that fosters intimacy. So many, many ways to foster intimacy, but part of what creates intimacy is emotional variability. So it's not just the happiness, the soothing tones, the calmness, the quiet, the expressions of love, although all those things are important. It is also that variability. We know that when people are angry with us, it's probably because they care or they're scared, for example. And so all of those things together can create intimacy. Referencing anger again, I would not be angry with someone I did not feel safe and comfortable with, because that is actually a very vulnerable mental state to be in and to share and be exposed in. Same thing with sadness or fear or anxiety, all of these things that you know well in relationship to your disease and its progression or what you're anticipating and the anxiety around all of that. So with the situation that we've all got right now, and presumably everyone is living with at least one other person due to the caregiving needs that are necessary. When we're talking about couples and also with families, when you start out in a relationship that is either transitioning into the caregiver and patient role, which many of you are probably familiar with, or where you're starting a relationship from the place of patient and caregiver, there is an inherent inequality to that, right? The patient is often treated as one down, or the weaker or less able, or sometimes even erroneously as the less smart or intellectually capable person. And with that, it's something where shifting into romantic life, sexual life, true intimate sharing, it can be very, very difficult to change the roles. We had an interesting early question come in about how do we balance out if one partner wants to be dominant, one partner wants to be submissive in a relationship. Oftentimes there are elements of submission when you are in a position of receiving caregiving. I would argue also that there's some empowering states around that in terms of learning to ask specifically for what you want and learning how to verbally express things that you may not be able to express physically. So for example, if someone is touching you in a way that feels uncomfortable, you may not be able to jerk your arm away, but you can use your words to say, I don't like that, I'm uncomfortable with that. The value of that is pretty profound because the thing that's a tool for safekeeping, which I'll talk about in a minute more extensively, is that you have this magical gift, which is your intellect, your imagination, your creativity, and all of that is alive and well. And when it is sparked, you can have romantic and sexual intimacy. It's also something where it's useful in terms of that non-sexual intimacy as well, because a lot of times life becomes mundane, especially I get reports from a lot of my clients right now that it's days are indistinguishable. You know, we're joking that it's, you know, July 33rd is coming up, right? No one knows what day or time it is. And it's either work or not work, work, not work, or it's a school day or it's not a school day. There's not a whole lot right now that is contributing to a sense of anticipation, of yearning, of longing, of desire, and that goes across the board. Also, a very famous sexuality and couples author and speaker and psychotherapist, Esther Perel, writes about the idea that over intimacy, over familiarity leads to a death of romanticism and sexuality. And I think that that is such a profoundly powerful concept. Um, the idea that there is some excitement in not being around a person regularly. If you've ever had a long distance relationship or had to wait a full week to see a person, there is so much more excitement that builds thinking about how that relationship is going to occur when it gets to be your time together in reality. And when we live together, it is not the being well groomed and well dressed and ready for a date and looking to be seductive. We see people in their underwear and with their unshaven legs and waking up to them with their bad breath in the morning, none of which is terribly sexy or appealing, and it doesn't tend to spark the imagination in the same way that these other circumstances do. But keep this concept in mind as we move forward here. There's a saying in German, which is, "For Freude ist die größte Freude." And I like this saying because what it translates to is loosely, anticipated joy is the greatest joy. So keep that in mind. Anticipated joy is the greatest joy. We're going to use that as a concept for building intimacy. And also, I would hope everyone that's here is here because they value connection. And again, intimacy, we're mostly going to be talking about couples, romantic intimacy, but it's also something you can take and expand out to family in terms of how you use these techniques. So with ability, disability, creativity, let's start right there actually in how I titled this slide. I tend to be fairly blunt about things. To say differently abled, for example, is a very useful term. The term I commonly hear from people, though, is I am disabled, right? So I like to think, though, in terms of broader abilities, because there is still all of this emotional capacity, intellectual capacity, feelings capacity, and the creativity. So I want to also touch on the fact that if you're in a relationship with someone, they're also going through their own process of aging and injury and possible disability. And that's always going to affect things in the couple's relationship, also in family relationships, of course, as people encounter difficulties and may need to move in and out of caregiver status or patient or recipient status. So sexual techniques, they need to change over your lifetime anyway. So even if we could extract all of the things like high blood pressure and muscle degeneration and back pain, you would still be aging and face hormonal changes and other changes in your body that might leave you having to adapt who you are sexually. So it is unreasonable and inappropriate to expect that the sexual being that you were as a teenager or in your early 20s is how you're going to be for the rest of your life. So aging, of course, comes with many things. Quite often it comes with medications. Medications have side effects that often include a decrease in sexual responsiveness. Menopause is well known to cause change in desire and in body shape and configuration. And where that leads is often to feeling uncomfortable physically in one's body, not wanting to get naked, not wanting to engage sexually. ED being both eating disorders and erectile dysfunction, but really here I'm talking about erectile dysfunction because we've all seen so much about it on the late night infomercials and such. The issues related to erectile function and dysfunction can be really impactful, very painful for couples, particularly for the men who may be having them. Within this particular disease, it is my understanding that should not be an issue. That, of course, is an individual thing. I would certainly like to hear from anyone who's willing to share information to the contrary on that. Other things that are big physical issues potentially are pregnancy and related issues, miscarriage, stillbirth, pain issues that may come up. Other things that happen in terms of traumas, so anything from a car accident to being beaten up or mugged or a physical sexual assault such as a rape. So all of those things can certainly be part of what is affecting our needs, our desires, our limitations. I'd also add in terms of trauma, things like childhood molestation are really critical, very vulnerable points. They often lead to a lot of internal emotional damage, feelings of being dirty, weak, bad, a lot of shame, and all of those things can affect desire. So bottom line is nobody really comes to the table, or in this case, the bed, as a completely blank slate, having no experiences or bodily limitations or mental or emotional limitations about sex and sexuality. Also, sidebar, other sorts of things such as addiction, drinking excessively, those kinds of issues are all problems. So when you start to go through this list, it's a miracle anyone's actually having a good, active, quote, healthy sex life. And you can have a healthy sex life in and around all of these things. Managing expectations is the key to this, of course. So this is the conversations that you're having with partners or perhaps prospective partners if you're dating. Again, a very difficult thing made more difficult already by the COVID-19 restrictions. But managing expectations and talking ahead of time about what your expectations are for your disease progression and for your level of desire or your willingness or desire to have sexual or other intimate contact. In terms of family life also, this is really important to talk about expectations. A lot of times this is big, scary stuff. We all know where this disease is going, and yet it's still hard to talk about. It's so hard to talk about what is going to be sad and difficult and perhaps even feel like a failure, although this has nothing to do with anything you've done. And so those are the kinds of honest conversations that are in and of themselves intimacy building, because intimacy really is, it can be broken down into me, see, intimacy, into me, see. And I like that idea of allowing someone to see inside of you. It can happen in many ways. Right now, there is a bit of a vulnerability for me in that I have to disclose to you, there is almost no research on this topic. I am certainly not making up what I'm telling you, but I don't get to be sitting here in my intellectual comfort zone. I'm talking about stuff that is really sensitive for people and where I wish that I didn't have this failure of information. When I do that, I'm building my relationship with you because I do already know and have met many of you. I don't know who all is on this call today or who will be watching later, but this is something where we're all learning together. And so that's one way of building an intimacy, right? Another big topic here that has come up is the idea of how do you create spontaneity? Because we tend to associate sexual joy and pleasure and intimacy with having spontaneity. This is going out to dinner and looking across the table romantically at one another and having to get the check early and go home, right? But that's just not the way it plays out when it's going to take you quite a few minutes to get separated from the restaurant into your wheelchair accessible van, get home, deal with the elevator, so on and so forth. So these are the limitations that we've got to incorporate in. Does it mean you can't have spontaneity? And spontaneity is a good thing. It's not an absolute necessity, but it's fun and it adds to the creativity. You will have to change and renegotiate boundaries, knowledge, awareness, capacity. You may need to be really aware that your partner is great in the mornings and feels half dead by 3 in the afternoon. If that's the case, it's going to be very different from someone who is a night owl and is raring to go at 2 a.m. If you guys are in different zones on that, like your circadian rhythms are not in sync, you'll have a little bit more of a challenge to negotiate, but it is all workable. Keeping in mind also some of the physical limitations that we're dealing with here, addressing the issues of, is it possible to stand in a supported way still? Would that be comfortable? Does that allow you to release inhibitions or to feel comfortable and relaxed physically? Is it better, even if you still have capacity to stand, to be in a sitting or reclining position? And sometimes also that is a different answer day by day. So to not assume, but to check in with each other and say, you know, I really do want to have this intimacy with you, and my body's feeling a little weak right now in a certain way that's a little bit unusual, or I've just done my physical therapy and I feel like this might be a little bit too much. Can we try this in a different way? Similarly, one of the things that I think is really difficult around physical intimacy is when you have lost the inability to easily use your hands or have access to both hands. One of the things that we really love and cherish is our ability to caress and to touch and to have those nerve sensations because our fingertips are very, very sensitive. So I would invite you to play with that. And if it's possible for someone to touch you, hopefully you can see my hands here, but just in a very light, sensitive sort of way. It's a way of getting connected and intimately. Sometimes just the lightness of touch is very intimate. So you might separate, it's hard for me to depict this without another body, but it might be something where there's a very medicalized kind of move, which is I am picking your legs up and moving them onto the couch, versus my hand is lightly on you and moving across your skin purely for the purpose of connection and pleasure. Similarly, this idea of adapting to where are you in the room. You may need to do things like mixed position hugs, so one person standing, one person sitting. Explore, does that get easier with both of you sitting or with both of you lying down in a comfortable place? That may feel like a more comfortable and equalizing sort of relationship. So not that this sort of contact has to be confined to bed. You could also take advantage of other furniture or the floor if that's something that's workable for you in a practical sense. Amplifying small gestures. again, very important. You know, we are living in such, I think unless you're living in a 5,000 square foot house right now, you probably feel like your house is too small. I'm in a 2-story house with one other person, and it feels a little too small right now, 5 months into this. So amplifying small gestures, that is not just physical. The intimacy is built in a continuous conversation between two or more people. And it applies to all levels of intimacy: the physical, the sexual, the medical, the intellectual, the spiritual, the environmental. And a note here, because I want to really open up a conversation if anyone wants or needs permission to go here, but I say that intimacy is a continuous conversation between two or more people. One thing that may get very lost when you are in a state of dealing with where your disease is at, where you can't express your sexuality and desire as fully as you might want, or it doesn't feel comfortable to explore. So two or more people may well be your family that you're living with, and so intimacy becomes a family conversation. But again, to come into the couple, you might be interested in having secondary or tertiary or even more relationships. So what if your natural desire heads in the direction of being polyamorous, having more than one lover? How do you navigate that when one person is primary to you, but there may be one or more secondary people? These are the kinds of situations and questions that for everyone require a lot of conversation, a commitment to radical honesty and clarity, and to being sensitive to one another's needs. And it would be certainly more difficult. It is not impossible. That being said, the discussions about sexuality, about intimacy, about relationship are all part of the relationship building exercise. So relationships don't exactly happen in a vacuum. Yes, they happen all the times. I have a relationship with my favorite clerk at Trader Joe's, for example, but different kind of relationship. Also, intimacy and a focus, a conscious focus on intimacy and building intimacy is something where you're expressing to one another that you love and desire to maintain and build and enhance a relationship. Because again, as aging and other disease issues come into play for both you and your partner, because of course, just because you have this disease doesn't mean you might not have another disease, life being as unfair as it often is. There are a lot of things that are going to change over time. And not everyone gets sick, but we do all age, and that could be affecting things as simple as you experience osteoporosis or bone loss, or some arthritis in your joints that makes things less comfortable. And that could be for a caregiver or for you. And so all of those things, they are very intimate. They're internalized. They are what is going on inside of our body. You know, people can see what is going on the outside of your body, but the inner part is still your possession. It's your world. It's your choice to talk about it. I would argue that talking about it is a really strong way of building intimacy, because this is where we are most vulnerable, is in our physical weakness, in our emotional neediness, if that is there. And so to talk about that and reframe that as a choice to expose, or a choice to share, a choice to ask for help, a choice to ask or discuss accommodation. So being really creative in this approach. This does not require, by the way, that you be an artist, a musician, a dancer in your soul, any of those things, okay? Creativity can happen entirely in your mind for these purposes. And it is the emotional as well as the real intentionality around it. So as we are well aware by now, intimacy is much more than sex acts. And thinking about intimacy, a lot of it comes through a complex system of desire creation that exists in all of us. And that is that it is not only that one thing you may have heard, and which is accurate, is that our skin is our largest sexual organ, but the strongest sexual organ is actually our brains and our minds, our mental powers, and our sense of emotions, whether that's our self-examination of them or it is simply what we are feeling in the moment. To be able to share that, again, is a vulnerability that creates intimacy. So in thinking about intimacy, I like to look at tone. So if I am saying things very harshly to you like this, that doesn't feel intimate, right? That was probably really startling and not pleasant, and I apologize. I wanted to illustrate the point. If instead I am talking to you in a pleasant tone, you are probably more willing and able to listen to me for a while. Why? Because the previous tone, which I won't repeat, it's awful, it's horrible, it's harsh. You want to get away from it. Sounds like it might even be angry and confusing, because why would I be angry with you? And when you talk instead in a tone that is consistent, or perhaps where you use nuances of tone for different people in your family. So it may be something where you have a very tone for your elderly and frail mother, or a tone that is very specific to your spouse. Just like if you have animals in your household, we always talk baby talk to the animals, which who knows what they're thinking about what we're doing to them. But to talk in very soft, gentle, intimate, maybe even really low tones, like whispering is a very intimate act. It forces you to lean in to hear what the response is. Tone also is in what is said. So it is in being more casual, more informal, more exposed, as opposed to something that is more formal, more protective, more public, right? Same thing with gesture. There is a lot of gesture that is possible. I'm sure everybody by now has been out in public wearing a mask because of the coronavirus. And one of the things you may have panicked over for a minute is, how is anyone going to know what I'm thinking? They can't see my facial expressions. And that's really hard. So you may have already developed this skill a little bit, but learning a little bit, practicing with your facial gestures, which are untouched, is going to be really helpful in creating that intimacy also. So it is not just the eyes, which we probably all have extra practice with right now, but certainly your mouth. My partner, for example, has this funny little way of curling his lip when he has kind of an experience of an inside joke with me. And I don't think anyone else knows what that looks like, but I know exactly what it means. And for me, it's one of those, ah, it's our shared reality moment. And so you may have some things like that with your partner as well. It may be a raised eyebrow, or a certain way that they crinkle their eyes or wrinkle their nose or make a surprise mouth. And so looking for those things and kind of seeing them as valuable tools for you. The same thing in terms of flirtation. It's been a while, but why not flirt with your partner? They deserve to feel good. Almost everyone feels good when we flirt with them. Obviously, all of the safety things, protection things, you're not going to flirt with somebody inappropriately in the workplace. But flirting with your partner, making a suggestion or an unnecessary touch perhaps is going to be helpful. The insinuations, if you have ever enjoyed doing something like texting with one another, there can be some flirty emojis, and those are the little emotional character expressions if you are not doing this. If that's not a possibility for you, that's also fine. You don't need to do every tool. You don't need to do things you're uncomfortable with. And certainly there's going to be some things that you simply cannot do, and all of that is fine. Also the promise, as I talked about with anticipation and expectation, one of the most romantic and sexy things to do with someone you love is to hint at what is going to be happening this evening or tomorrow or even next week. It is to say, we have a hotel room for a long weekend. You know what happens when we have a hotel room for a long weekend. Or it is to say, I can't wait to be naked with you. And I'm so glad that that is going to happen in a few hours. And so those things are kind of the non-subtle statements. There can be other more subtle statements about it, but anything that reminds your partner, and this is really important, we all need to feel wanted in an emotional way. Broadly for family and other people, we need to feel wanted, like we have something of value to offer. But specifically with our partners and in that romantic and sexual sense, even though we may be aging or have gained a little weight or are dealing with a broken leg or anything else that is going on in the body, we need to know that our partners see us as we are and love us and want us, find us beautiful and desirable in some way. Don't assume that your partner knows that. Don't assume that your partner knows that if your partner is also your caregiver. We need to be reminded. I was going through some photos and wow, you look so good when you're dressed up in a suit and tie. Or I think that shade of green just brings out your eyes in the most amazing way. You're so pretty, right? Those things, very small, very important. A few words can make someone's day, just like a few words can break someone's day. So the mind and the imagination being these really powerful tools for intimacy and sexuality. Talking with one another, even if you are not actually doing something, even if you are not having the physical touch, you're not even in the same room. So, and you've talked to someone who is far away, but you are exploring what your desire for them is, that could be very big intimacy building and building for sexual appetite, building intrigue. Again, this idea of flirtation or hinting at what might be coming in the future. It's also something where there's an opportunity in the talking to maintain authenticity. I often have a lot of laughter in the sessions that I'm doing in therapy. And I've got to say that I think that our capacity to be sexual as humans, if we were able to step up in a position way up in the sky, 100 miles away, and look down at all the humans doing their sexual things, wouldn't it be kind of hilarious? I think it might be. So, given that you've got this disease that affects how your body moves or doesn't move, there's going to be some funny moments. There may be falls or a limb that ends up in an awkward place or something that you try to do that is just not working today. It is okay, and I would encourage you to give both yourself and your intimate partner opportunity to laugh around that, because human beings are funny creatures. Laughter is bonding, and laughter also offers a release of tension. It can be a way to help you move through an awkward or painful moment and on to the next thing. And I want to also address within this, I've talked a little bit about boundaries, but the dark side of intimacy and sexuality when you have a chronic illness, and particularly a chronic illness that affects movement or your ability to care for yourself. So many of you that I have met require assistance with getting in and out of your chair, for example, or some other assistive devices. You may also require assistance with toileting or bathing or getting dressed, all of those things. And like I said in the beginning of this talk, one of the things that can happen is there's this real power differential that gets reinforced. Taken in a positive, conscious, deliberate way, that power differential can be exploited for connection and intimacy and even sexual pleasure. The dark side of it, however, is that to many degrees, you have lost agency over your own body if you are the patient in this case. And it is very important, doubly important, that we all have agency over our own bodies, especially for anyone who has had any sort of incident where that agency was taken away from them. So whether it was through physical abuse or sexual abuse or some sort of attack. Also, if you are female, there may be more of a need to exert some control. And so the issue of consent and boundaries is really powerful. I think it is an issue that has all come into our consciousness in recent years with things like the Me Too movement. Um, but it's something that doesn't just exist within the realm of trauma, damage, disease. It is something that we should all be aware of, and the fact that something has happened previously doesn't automatically give consent for it to happen again. Okay, does that sound really boring and annoying and inconvenient? Maybe, but hear me out. This is actually another opportunity for intimacy building. It is a way of empowering. It can be exhilarating to have that power. It is a way of sharing power in a healthy and mutually agreeable way. Well, what are we doing in a sexually intimate situation? We are sharing power. We are surrendering to our lover. We are allowing our lover to surrender to us. And so those are things where it is that double-edged sword, but it's an awareness and a necessity, and it can be used to talk about it. It may be something where some awkward jokes arise. It may be something where curiosity. Oh, can you tell me a little bit more about that? I never talked about that. Like, I don't know. Are you interested in blank, blank, and blank? And see where that goes. It might give you some new experiences. Along the way, you might encounter some shame, and human beings, we're not actually hardwired for shame, but it feels like it because it's been bred into us, I think, from practically the day we are born. And we all have a strong shame mechanism, particularly within some cultures and religions. There are many elements of shame that we have learned or been taught. Again, also with things like having had any sort of history of sexual violence, the idea of shame comes up strongly for people in general who are dealing with chronic illness or disability and feeling less than or suboptimally functional or non-functional. People often tell me that they feel broken or damaged. And when those are dominant emotions, they're not going to open you up to contact with other people, to sharing your experiences, or especially to sharing your body. So know that we all have these things we feel uncomfortable about. And again, all of the other things that happen, it may be something as simple as you have not been able to get your hair properly done since all of this started, and you feel exposed. You have a lot of gray roots and you feel a little shaggy, right? Those are very surprisingly shame-inducing things. And we all want to appear at our best and our finest. And so having a lot of compassion for one another right now, compassion for the wrinkles and the rolls of fat and the skin discolorations and all of the rest of it, really powerful. When you have that kind of ongoing dialogue about intimacy, you can find an opportunity to amplify your intimacy through a number of different methods. I've talked about some of these. I'll kind of go through the list here because I think we're running close to Q&A time. I know we can go over a little bit, but I want to try and keep this contained for you. So talking about light touch or touch with tools, someone raised a question regarding using something like a feather as a way of contact. I think that's a great idea, very useful. It may be something where you don't have a lot of capacity to lift a heavy object, but you could perhaps manipulate something light like a feather. It's also something where when you are depriving yourself of some senses. So imagine what it would be like to have your eyes closed and have someone, brushing very lightly over your skin, either with their hand or with a feather. It could be very arousing. Similarly, we talked about the eyes. Eyes are very seductive. They say they're the window into the soul. And how you look right now. For example, I notice when I'm talking about eyes, I'm more conscious of my eyes and whether or not you can see that I am conveying the warmth and the caring that I feel for you through my eyes or perhaps the tilt of my head. Also the tone of my voice, obviously, and the choice of my words, to be respectful, to try and use each other's language and not to impose some other language. Of course, I love to drop in psychology words because that's who I am. But getting into what's simple, you don't need technical terms, you don't need psychology words to build intimacy. To the extent that you can in a specific way, things like sharing notes or little messages. This could be if you are able to effectively use something, I don't know, like with an Alexa device or through Siri on an iPhone, and to dictate a voice message either through text message or an email, or dropping that in through WhatsApp. Could be sharing a picture that you find beautiful or stimulating, or something that elicits a really strong feeling of vulnerability in you, or that brings up your feelings of tenderness. So that is something that is a nice side effect of our access to technology and social media and all of that. Conveying compliments. I think that you could get sick of compliments if there were too many of them and they were disingenuous, but for the most part, if the compliment is legitimate, if you say, I really appreciate you putting the extra effort into making lunch look like such a beautiful, appetizing thing. That's going to elicit all the warm fuzzies in the person who did the lunch preparation. Talking about, I mentioned about music and dance, and it's still certainly possible to share the sensuality of dance for many people. So, wheelchair dance or scooter dance is definitely a thing. And that's something where you might be able to find some shared space, some fun, some intimacies, some sexy moves if you've got them. And that can be something also where this idea of, what is your song? Do you have a song? Is there some music you love? Is it sappy, romantic? Is it Tom Jones? Is it Barry Manilow? I don't care, no judgments. Whatever it is that kind of puts you in the mood. Oh, let's not forget Barry White, the classic. These are things that get us moving, right? Because we can be aroused through all of our senses. So touch, smell, sound, of course, tone of voice, a lover whispering in your ear, you whispering in your lover's ear. Sharing also the stories that we have, the history that we have. There are people who have gone with us a very long way in our lives. And of course, also when it comes to sexual intimacy, because the other part of it can be for anyone, obviously, but our sexual fantasies may be something that also builds intimacy, because they too offer a lot of vulnerability of saying, I am really, really aroused by feet, for example, or to say, I'm very turned on when you're half dressed and half undressed. Could we play with that? And those are things where I think that you have tremendous opportunity within couples relationships. So, oh, how perfect was that? It's right about on time to review the key takeaways. Intimacy is for everyone, abled, disabled, young, old, well, sexual intimacy only if you're over 18, technically speaking. But intimacy being more than sex, intimacy being a continuous conversation between two or more people. So again, family, friends, workers, coworkers, colleagues, those are all intimate environments potentially. Sexual technique and needs and limitations do change through the lifespan of all people. I hope that in this conversation and information that I've presented today, that it highlights the awareness that this is about two people, not just one person's body, which hopefully feels a little bit refreshing and relieving, that we've got more of an equal position on that. Creating accommodations together is a way of building intimacy. Having the conversations is a way of building intimacy. And sharing anticipation and the mental play, using your mind to full effect and benefit, using your creativity in words, thinking about something you want to say that might be a little off color, but totally appropriate for the one you love or want to be making love with. And also an invitation to continue the education and exploration. As we mentioned at the beginning of this, there is an astonishing lack of information and research about sexual health and functioning in anyone other than the young and healthy or the erectile dysfunction market, because that is so lucrative. And so the rest of this is on us to figure out. There are many things you can search on the internet. There are conversations you can continue to have with gynecologists, physicians, therapists, occupational therapists, chiropractors, all of that, to continue this and to draw out information that's going to be useful for you. So I am opening it up for questions and comments and feedback right now. Thank you.
Well, thank you so much, Gretchen. This was a wonderful presentation, and you covered so much information and a lot of things that I know patients have brought up before. Some of the questions touch a little bit on what you're presenting, but I guess they want to delve deeper into things.
Sure.
So I'm going to give you a couple of them. The first question is, GNE myopathy makes us lazy, especially the men. As a result, we tend to slowly become more of a taker than a giver. Is that bad? Or is there any way to remain in a healthy, intimate relationship despite being the taker during intimacy?
Okay. First of all, I would invite you to consider that that's very self-judgmental and harsh. I think that when we are dealing with GNE myopathy and many other chronic illnesses, fatigue is just part of the picture. And sometimes it is really monumental fatigue. So it's not that you are desiring to be fatigued or that you are choosing to be lazy because you don't want to do something. And there may be some elements of that, and that gets deeper into the relational situation. But can you have a healthy relationship where one person is primarily the recipient or the taker? The answer is yes, if that is the agreement between you. Now, if it is the default and 95% of the loving goes to one person, I would say you're going to probably end up with some anger, some resentment, even some jealousy happening within the relationship. But if it is a conscious choice, and that is often something that is a conscious choice for people, it's a particularly common choice sometimes in relationships where one person has had some sort of history of sexual trauma. It may also be common in same-sex relationships of some sorts, or in relationships where the power play is a part of the sex play. So like in BDSM or sadomasochistic bondage and discipline kind of relationships. So there is the possibility of having it be healthy, but what creates the health is having the conversation about it, not just laying back and saying, please me. Oh, you? Yeah, thanks. That doesn't work very well.
And I guess because the person asked the question, they're probably feeling uncomfortable because of the nature of the limitation, that they feel like they aren't giving as much. So I think you're spot on and like having that conversation.
Yeah, and I think also having the conversation that may be something like, I am unable to move a lot of my body, but in my mind, if I could, what I would be doing to you right now is. It will spark your lover's imagination. It can be very arousing. It's also something to say, not to have to apologize for having a disease or having the limitations associated with the disease, but to say, I am aware that this can get unbalanced. How do I help balance it out for you? And what can I do for you, with you, to you, that will feel really good and like we're really sharing? Because as much as I love receiving from you, I love you, and I also want to give to you.
That's beautiful. I think that's a really good tip, because I can imagine that is a common theme that happens when you have a physical limitation. But I like what you said, even just about the visual of saying what you would like to do to them, even though you might not be in a position to do that. So another question, I know you talked a little bit about hugging and wheelchairs, but one of the questions was, I'm struggling to keep my balance when hugging my partner and sometimes feel awkward about that, even though my partner probably doesn't care.
Okay. So again, the conversation would be key to this. It might just be talking about that, because one of the things that happens with all of this, I think, is no one wants to appear to be weak physically or vulnerable. Sometimes there's also a little bit of fear of, I'm noticing this thing, like last year I could pick up something that weighed 2 pounds. This year I can only pick up something that weighs 1 pound. And knowing what that means and not wanting to make it real by bringing it into the room. But if you can say something, it's simply for comfort. Hey, I've been noticing that when we hug, standing up, I'm having a really hard time making sure that I'm staying balanced. I can't really control that voluntarily. And it kind of makes me nervous and uncomfortable. And I love enjoying really long hugs with you. Could we adapt how we're doing this?
Okay, it's a nice script. You guys can always come back if you forget exactly how she said it. Listen to it again, but that was nice. All right, and then another question, I'm just grabbing it, was similar to, I used to like to hug, cuddle, and caress my husband as a foreplay. Now this is much harder. What are some tips you would suggest as foreplay? I know you touched on that a little bit, so I don't know if you want to talk a little bit more deeply about that.
Definitely in terms of foreplay, keeping in mind some gender differences. So women tend to be very good at creating a romantic scenario. A love relationship will lead to those romantic feelings. That then leads to sexuality. For men, there's still a very strong and dominant, really, visual component that's necessary in terms of getting aroused. And so it is something where it might be, that there is a choice of your garment or an undergarment. So for example, a subtle cue that, if you see my red bra popping out, you might know what mood I'm in. That also kind of heightens awareness. It's like, oh, is it there? Is it there? Starting to have the conversation, and also using, if you can get a little bit comfortable with the words, so thinking about what you would be doing with your hands or your body. If it's not possible to be pressing into his body in a certain way, then is there something where you might make use of your head or your hair or a piece of clothing that you can move around him in a way that is perhaps feeling like it is caressing? Or it could be those very small movements, or focusing in on more sensitive parts. So one great thing is that we have a lot of sensitivity. Our necks are really vulnerable areas. And for most of you, that's still going to be something where that is a good sensitive area, certainly for a partner who is not dealing with the same situation in their body. The neck is going to be really sensitive. So things like this part, like on the side of the neck, is a tremendously tender and vulnerable place. Think about animals. They're going for the jugular, they're going for the neck. Ears, similarly, are incredibly sensitive. So not just to tone, but also to touch. So if there is a way to not have to stress and strain so much and try to make gross motor movements happen, but to stick to very small movements. So you could actually get a very heightened state of sensitivity from, having him place your arm on his leg, unclothed, obviously, and just using the smallest pulsing of your fingertips to create a sensation, right? Or using the warmth of your body without the movement of it. Because all those things are kind of primal connections. When we feel someone that close to us, when we hear those intimate soft tones like the whispering, I'm thinking about you, right? It's very different than when I'm having a very, educational conversation, right? And those things can be they can really elicit quite a lot of arousal. So it's a way of rethinking about, frequency, about length of contact. Knowing also, I didn't talk a lot about timing, but you may need to allow a little bit of extra time to just explore, to play, to see what's interesting to you, what's possible for you, or as each change happens for you. So again, this ongoing conversation, but it can be a physical conversation as well as the intellectual conversation.
I'm really glad you talked about the ears and the neck, because I think so much time people get used to their same rituals and think they need to be more physical, when even the lighter touch is just as arousing and can also be equally, if not even more effective. And it's a good reminder to everybody, whether you've got limitations or not. So thank you for bringing that up. Another question, and this is from a caregiver, which is good. My primary love language is physical touch, kind of like we were talking about.
Okay.
I love when my husband caresses my skin. Over the years, he's lost more strength in his hands, which makes it harder for him to caress me. So the caressing is becoming less frequent. I also get a feeling of guilt sometimes to ask him to caress my skin, knowing that his arms and hands are getting weaker and that will make him tired. I understand he can't help to get weaker. However, I can't help but to feel a little sad about it, to lose that type of intimacy slowly. I'd like to know how to deal with these mixed feelings of guilt and sadness. And there's a lot of questions here. Another situation is, most of the time we are tired, and intimacy at moments feels like too much work for us, and we're having a hard time navigating how to be intimate. At moments, I feel like thinking of not trying to be sexually intimate anymore makes things easier, which I'm sure that's a lot to be packed in, but I'm sure those are common themes.
Those are very common themes. We could do a whole nother hour on all of that, I'm sure. So the sadness. Look, this is sad. This is horrible and hard and difficult and awful and icky and annoying and enraging and all the feelings. And allowing yourself to have some space for that, and especially I think caregivers in general have got the world's highest level of guilt. Caregivers never feel like they are doing enough, even when they are doing everything and wearing themselves out in the process. So being aware, being attentive, being mindful, and also you are allowed to have your own sadness. This loss of physical capacity, the loss of some specific forms of intimate sexual capacity that you really love, they are losses to be grieved. And they will go on for a long time because of the nature of this disease. And so it is something where the guilt, I think, is something where I would say, look, if you know in your heart you are doing everything you can to maintain your household, your family, your own body and mind, an income source, as well as the person of your beloved who has this disease, you are doing well enough. And, it's okay to share some of that sadness and grief. The person who has it knows that you're sad about it. They're sad about it too. It would be a nice gift to actually talk about being sad together. Now, for the specifics physically, one thing that could be done, again, this gets into consent. It sounds like the use of arms and hands is very tiring for your husband. And so you also feel some guilt about asking for that, like you're being selfish for asking for that need and that desire to be met. And that is not selfish. What it may mean, though, is that it needs to be something where you allow him to stop sooner than you would like, because you can sense that he's getting tired. It may also be an opportunity to say, would it be okay if I used your body for my own pleasure and comfort? Would it be okay if I undressed and rubbed myself on your body or on your hands or arms, right? That is a powerful sexual act. It's also very powerfully intimate, right? And it can be a real twist on things, so you can get that tactile sensation and also be giving something at the same time. Because for most men, having someone they love take off their clothes and rub themselves all over them is not a bad thing.
Okay. Thank you. We have a couple more, but I want to encourage. That was a lot. You covered all the questions in there, so it's a lot. if you guys have more questions, feel free to send them directly to me. I'm going to ask one more that has come in, but I also want to, we can go a little bit over because these are great questions, and I'm assuming that you guys are not the only ones that have it, and anyone's listening is going to benefit from hearing your question and Gretchen's response. One thing that had come up is intimacy, not necessarily with your partner, but wanting physical connection and hugs and kisses and from your family members, but not sure how to go about that, because some patients often feel like people are afraid to approach them and respecting their boundaries. So how does someone go about expressing what they're needing from their family, whether it's their children, whether it's their aunts and uncles or nieces or friends? Can you give us some tips on that?
Yes. This is definitely something, a lot of times people will see someone who is using crutches, a cane, a wheelchair, a scooter, and think, oh, they're fragile, I can't touch them. And so what happens then is you get deprived of touch, and you get deprived of some common social sorts of things. Now, right now in the age of COVID, hopefully nobody outside of your immediate household is touching you. But in general, those are great things. Hugs are very helpful. They feel good. They activate all the happy endorphin things releasing and all of that. So saying something really direct, like, I've noticed that you hug the rest of the people in the family, but you don't try to hug me. I know it's awkward, but could we try? I'd really like it. Or saying, if somebody is coming into the room and you see them, hugging your kids, and if you are able to reach your arms out, or to say something like, I can't pick up my arms to hug you, but I'd like for you to hug me, please. Right? So really letting them know, and it may need a little bit of reminding a few times to go, oh yeah, she's not going to break. She's not made of tissue paper. I can hug her. This is good. Letting people know.
Okay. And I think one other thing that came up, and I don't know, this might not be so relevant, but sometimes it's also hard for people that don't know how to respond, whether it's a friend or someone, of how to address the issue. What do you suggest for someone on the other end?
Yeah, you mean for not the patient, but for other people?
Right, like if somebody, for example, etiquette of like how to approach a patient, like you don't want to, how do you go about figuring out what their comfort level is?
So yeah, that's a great question. This is something we all need education on. Unfortunately, of course, it will fall upon you to be the educator many times. In addition to thinking that someone who uses any sort of assistive device or has any disease is weak or fragile, there is also something that happens, which is a horrible dynamic, which is this treating you as if you are a child, or that you have limited intellectual capacity, that you are mentally retarded, or that you are not a fully functioning adult. And the reminder is, the body may not be working, but the brain is totally online, and let's have a real talk about this, right? As with everything, sometimes humor is helpful. I've noticed some behavior, people will invade your space. They'll assume you're deaf, which I don't even know what the psychology around that one is, but they may start talking louder and more simply, and you can say, I'm not hearing impaired, but thank you. It may be something, I've seen people using baby talk to adults, same thing. That's an interesting way you're speaking. Could we speak adult to adult, please? Not a whole lot of judgmentalism or shaming in it, but just indicating, I'm a human being, I have rights, I have preferences, I'm an adult, speak to me like an adult, my brain works fine. So for the person who knows nothing about this, I would always say, approach with respect. Some people are far more volatile than others in terms of their personality. Some people may have, just gotten out of an interaction with someone who's behaving like an idiot and they snap if you talk to them in the wrong way. Be aware, be sensitive as you would with anyone else. And don't ignore the fact that there is something going on. When you see that someone cannot move their legs by themselves, or you see them in leg braces, ask, I see that you're in leg braces. Is it okay if I ask you a little bit about that? I want to know if there's anything I can do to make our time together easier or more comfortable. So, for example, when someone comes into my office, I had a new patient a few months ago who wanted to write down some things I was telling her, and I tend to speak fairly quickly, but I noticed that she had a slight hand tremor, and I realized that she was writing very slowly. That was on me, because I'm a health psychologist, and I said, I see you have a little tremor. Would it be helpful if I wrote this for you, or would you just like me to speak more slowly and leave long pauses in what I'm telling you, right? So giving some power back to the person who may be struggling with some sort of disability, allowing them to make the choice about it. They may have developed an excellent memory and just be taking a long time writing, like in this example. Does that all make sense?
Yeah, no, that was really helpful, of not just doing it for them, but
Exactly.
asking them. I like that.
Exactly.
And I think that comes with a lot of things, whether it's opening doors or getting someone's food. And sometimes people have the natural ability to want to help and rescue, but sometimes the patients want to do that for themselves. So I really like that.
I'm a big advocate for maintaining as much autonomy in that regard as possible.
Right.
And I think that's probably a medical recommendation as well, is just to do as much for yourself for as long as possible. My other observation about that is that well-meaning, able-bodied people get hilariously in the way of people who actually know how to do things like get themselves out of bed and get the door open or put groceries into the cart without, like, we don't have to understand how you get it done, right?
Right. Thank you. I feel like we covered so much. I thought this was incredibly informative, and thank you for everyone who was brave to send some very personal questions.
Yes,
We got to dive deeper into things. That's always good.
Really good questions. I really appreciate it. It's hard for me when I don't get to see you and kind of respond in the moment, but thank you so much, Carol, for making all of that work. And I'm happy to see you guys again. And I hope you're all
Thank you
well.
so much. I mean, this is a great topic, and thank you for also the patients who requested this. I know you took a lot of time, and it was incredibly informative. And so thank you, everybody, for joining the call, and thank you for those that are listening. Appreciate any feedback you have for either of us or any other topics you'd like us to cover in the future.